Hi, we're Team 3, and we chose to analyze the case in Chapter 6, the Patient and Family-Centered Care Methodology and Practice. I'm Sarah.
My name is Maureen.
I'm Tara.
And I'm Tammy.
So we first wanted to just give a little context into the case, a little bit of background about it. So the main physician involved in the quality improvement is, for simplicity's sake, we're going to call him Dr. D. And so he was has a background in engineering, and then that led him into biomedical engineering. And then from there, he decided to go to med school, where afterwards he mainly worked in orthopedics. And so he started the methodology in the orthopedic practice of Shadyside Hospital, which is part of the University of Pittsburgh Medical Center. And so this methodology, PFCC for short, patient and family care, centered care. And so we'll go into that. And then why he wanted to do this, because he recognized that patients weren't being put in the center. Not everything about their care was being analyzed, and he saw there was room for improvement. And he found these areas of room for improvement through shadowers. And so just some of the issues, patients, like I said, he recognized that they weren't considered the center of medical treatment. And so say that a patient is getting surgery, the doctors who are surgeons were only focusing on their part of the medical treatment, and then they weren't collaborating with the pre-op and post-op, anyone involved in care with that patient. And so in the example of orthopedics, he worked with a lot of knee and hip replacements. And so he recognized that a lot of surgeons would just do the knee and hip replacement, but then they wouldn't work with the PT person after and making sure that the patient is doing all the necessary treatment and even like pain meds and stuff like that. It wasn't all being thought of at once. It was all separated, which he realized was a problem. And so that goes into a lack of holistic care, not focusing on the whole person. So psychological, physical, and emotional care for both the patient and the family of the patient. And then again, there was a lack of collaboration between care teams. So there was a separation, and he recognized that there needed to be combined. And so the book also talked about how he, in his engineering background, he first came up with like innovative new technologies that were great, they were working, but there was something missing. And he realized that that patient-centeredness wasn't being combined with the new technologies. And so that's where he saw the room for improvement.
And just to add, he just said that the technology wasn't necessarily going to improve quality outcomes, and that focus on patient-centered care was the best way to improve quality outcomes. That's what he came to find.
And then the reason that the book chose to analyze this case, and one of the things it emphasized was that simple solutions can really be the most effective, even in like a very complex health system. And sometimes it's really those minute details that can really have the biggest impact and the biggest effect. One of the things he found was that a lot of times people focus on money or adding all these resources, but it's really about refocusing the existing resources that you do have that can really be the most beneficial. Another goal that it analyzed was the importance of understanding the patient perspective through the entire treatment plan, and really just through the eyes of the patient. And so Tammy will kind of talk about this in the next few slides, but they used these people called shadowers who kind of walked with the patient even before they entered the hospital, and just what that experience looked like pre-op and when they entered the hospital, and then post-op as well. And then also just the value of every team member knowing their role in the care plan, and just including everyone in the care plan. So the book kind of emphasized even the parking attendant and the secretary, the hospital receptionist, especially the family and the caregivers in the care plan. And in the example in the book they used, they focused on the parking attendant. And so a lot of times at these bigger hospitals, parking can be a very anxiety-inducing just thing that patients experience even before they enter the hospital. And so really what they looked at was how can we minimize that anxiety for the patient even before they enter, and how can that improve quality outcomes. So that was something really important that they noticed. And the book even said that one result from looking at the parking experience was a reduction in operating room delays, which in turn improved efficiency and productivity in the hospital. And then the last goal that they analyzed, or the reason that they analyzed this case, was they found that patient and family-centered care is really a methodology for upholding the triple aim, which the triple aim looks at reducing cost, improving patient experience of care, and then population health as well. And then some key facts that our team noticed in this chapter was that loved ones really play a large role in the patient experience before, during, and after the care. And a lot of times having a care coach that can walk through the process with them and be designated to hold them both accountable and are both available for the patient, that's really important. And just also someone that they can trust. Our group kind of discussed that the accountability aspect is super important to make sure the patient is doing their PT, their exercises, pain management, and just helping to get around to different places. Another key fact we determined was that working harder or more efficiently is not always the solution to improving outcomes. Sometimes, like we talked about, it is that minute details that make the biggest difference, and then also refocusing existing resources like I had mentioned in the last slide.
Some of the solutions talked about in the book and that we're going to hit on today is Sarah mentioned having a shadower and a care coach. The shadower is someone that observes the caregiver at each touch point in the care to make sure that the patient is being put first and understands how and where to park, is following the pre-op instructions, getting all the pre-testing done all in the one stop shop for because people tend to have to go one place for pre-op blood work and have to go someplace else for x-rays, and all of this can mean time and money and time off work, and that's not actually convenient for most people. So the doctor talked about a one-stop shop for pre-op testing. You can get your cardiology, your blood work, your x-rays all done in one place. And what a shadower and a caregiver will help do is make sure that you can make those appointments, make sure that you have the transportation, make sure that you have the 2 hours or 3 hours needed to have all of this pre-op testing done. They can also make sure that the step-by-step instructions are not just handed to the patient on a piece of paper, but they actually understand the pre-op instructions, where to park, where to go on the first day, how the pain management after surgery is going to work, and what the rehab process looks like. Working in the medical field myself, I know I receive patients all the time in the home health line where the patient goes, gets a knee done, and then they've seen the surgeon for 5 minutes after surgery. When they woke up, sent home with a list of instructions, and that's it. And they really didn't know what else was expected of them. So this process really talks about going through the instructions and what the patient needs to do to recover fully. And again, talking about the care coaches, making sure you have someone there that can really assist you with making sure that you're following the pain management guidelines, you're following the rehab instructions, you're getting up and you're exercising, even though it may not be comfortable right after operations. It's the most effective for recovery. And the care coach is just going to make sure that you're following all the diet restrictions, the exercise restrictions, weight bearing restrictions, things like that. They can also help with answering questions for you. And the picture on the screen is taken right from the book. It's the touch points. And we kind of hit on that already. If a patient is comfortable and understands where to go on the day of surgery, it's going to make them more relaxed, more ready to go, more comfortable with the procedure. If the receptionist knows why you're there, they can greet you, not seem confused on why you're there, what time you're supposed to be there. They will be expecting you. Again, all of it comes from just making sure that everyone knows their role in the entire case from start to finish.
And then some alternatives and recommendations when we were discussing these. A lot of these are just continuation of Dr. D's idea of providing holistic care to patients. So some of those alternatives or recommendations we came up with would be to have a follow-up with home health services automatically be given to the patient. They'll have a follow-up, and this will help with things like expenses and financial burdens that involve helping with possible health solutions. And so obviously this example was talking about hip replacements and knee replacements. And so sometimes if, I had 20 steps to get into my door, I might need a ramp or a chair lift if I have 20 steps inside, or shower chairs and things like that. And so we just think a home health follow-up will be important in making sure that people have the correct resources and availability to those resources. And then a second recommendation that we thought was really important was to provide support groups for patients post-operation. And this was to support their mental health, but also we talked a lot about having care coaches throughout this whole thing. And so something that was really important that we hit on when we were discussing this was that not everybody might have an accountable and available care coach. If I am going under a total hip replacement and my only loved one is my daughter who lives 8 hours away, she might not be able to help me get to PT, and she might not be able to help me feel motivated. And so these support groups would be beneficial in helping a patient not feel alone, but also to provide just that support, that motivation. And it can also help provide resources, to someone who might install cheap ramps. It might help me meet a friend who had a similar surgery and they have tips and tricks, or maybe, they want to go take walks together. And so just building rapport within a community that went through a similar situation is something that's really important. So on the next slide, that was the recommendation that we decided to go with, that we would recommend. It would just be to continue that holistic approach by suggesting support groups and suggesting that people get in them, whether or not they have a good care coach, just because the relationships that you can build and the tips and strategies and all those things can help any patient recover. And at the end of the day, it's about helping a patient have better health outcomes, completely holistically, not just physically, but also how they're feeling afterwards. And so then on our next slide, we incorporated some supporting material just to help everybody kind of understand what we presented about today. So this first YouTube video is something that I found, and this goes into, it was really good explaining what patient-centered healthcare was, but also just the need and what happens when we lose focus on that and we focus on, money. And like we said earlier, like we're just focusing just on the surgery and not the entire process of that.
And then that next link shares a study that was done, and it basically talks about how to reduce any anxieties, and it goes through therapies that were recommended to reduce those anxieties. Dr. D talked a lot about, if you bring a patient in with no other anxiety except for the actual surgery, then they'll feel less anxious about that surgery, and then the outcome after surgery and the days to follow will be much better. And so we just wanted to share something that supports that idea of the importance of reducing patient anxiety.
And then finally, that last article I found on the NIH, and that was presenting a big study about a hybrid model, but the entire focus of it is holistic care. So what is holistic care? How do we give it and then the better outcomes that come with holistic care. And so we just put that to emphasize what we really mean by taking care of the mind and the body as they are one, and how that can improve patient experience as well as a whole facility's experience. So
Thank you so much for listening to our presentation about Chapter 6.
Thank you.
thank you.